Philippine Nurses Licensure Examination. Nursing Practice 2. Care of the mother and child. Master your nursing practice 2. Let's start. Situation. Nurse Andrea is an independent nurse practitioner conducting home visits for postpartum clients. She visits Amanda, a new mother discharged 3 days ago after a vaginal delivery. Andrea's focus is on Amanda's recovery, newborn care, and educating the family on supporting Amanda during her postpartum period. Question number 1. During her first visit, Nurse Andrea assesses Amanda's incision from an episiotomy. How often should Amanda perform perineal care to promote healing and prevent infection? A, once a day. B, every other day. C, after every urination or bowel movement. D, twice a day. Correct answer. C, after every urination or bowel movement. Explanation. Perineal care is crucial for preventing infection and promoting healing, especially after an episiotomy or tear. Performing perineal care after each urination or bowel movement helps keep the area clean and reduces infection risk. Question number 2. Amanda reports feeling overwhelmed and tearful at times, even though she is happy about her newborn. Nurse Andrea recognizes this as A, postpartum depression, B, postpartum blues, C, postpartum psychosis, D, general anxiety disorder. Correct answer. B, postpartum blues. Explanation. Postpartum blues, often called baby blues, are common emotional changes due to hormonal shifts, sleep deprivation, and adjusting to a new life with a baby. They usually resolve within 2 weeks. If symptoms persist or worsen, it may indicate postpartum depression, which requires intervention. Question number 3. Amanda asks Nurse Andrea how soon she can resume light exercise to help regain her pre-pregnancy shape. What should Nurse Andrea recommend? Letter A, immediately after discharge. B, after 2 weeks if there are no complications. C, after 6 weeks, following the postpartum checkup. D, only after 3 months postpartum. Correct answer. B, after 2 weeks if there are no complications. Explanation. Light exercise, such as walking, can usually be resumed within a couple of weeks post-vaginal delivery, provided there are no complications. However, more strenuous activities or exercises that impact the abdominal muscles should wait until the 6-week postpartum checkup. Question number 4. Amanda is breastfeeding her baby and asks about increasing her milk supply. Which recommendation should Nurse Andrea give her? Letter A, breastfeed on a fixed schedule every 4 hours. B, breastfeed frequently and on demand. C, decrease fluid intake to avoid engorgement. D, use a pacifier to give her breasts a break between feedings. Correct answer. B, breastfeed frequently and on demand. Explanation. Frequent, on-demand breastfeeding encourages milk production through a process called supply and demand. The more often a mother breastfeeds, the more milk her body is stimulated to produce. Scheduled feeds can disrupt this process, especially in the early weeks postpartum. Question number 5. During the home visit, Amanda's husband asks Nurse Andrea how he can support Amanda during her postpartum period. Which of the following is a beneficial suggestion? Letter A, take care of the baby exclusively to let Amanda rest completely. B, encourage Amanda to sleep and rest when the baby is sleeping. C, monitor Amanda closely to make sure she's losing weight. D, take charge of all decisions regarding the baby's care. Correct answer. B, encourage Amanda to sleep and rest when the baby is sleeping. Explanation. Encouraging Amanda to rest when the baby sleeps is beneficial for her recovery and well-being. especially during the postpartum period when she may be sleep deprived. This support helps Amanda recover physically and mentally while still allowing her to bond with her newborn. Situation. Nurse Carla is providing home care for Julia, a new mother who had a cesarean delivery 4 days ago. Julia is eager to care for her newborn, but is still experiencing discomfort at her incision site. Nurse Carla's goals for this visit are to assess Julia's physical recovery, educate her on self-care, and support her in caring for her baby. Question number 6. Nurse Carla assesses Julia's cesarean incision and notices some redness at the incision site. What is the most appropriate action? Letter A. Apply warm compresses to the incision. B. Advise Julia to take over-the-counter pain medication. C. Inform Julia that redness is a normal part of healing. D. Contact the healthcare provider for further assessment. Correct answer. D. Contact the healthcare provider for further assessment. Explanation. Redness around a surgical incision can indicate infection, especially if accompanied by other signs like warmth, swelling, or discharge. Nurse Carla should notify the healthcare provider to ensure Julia receives timely evaluation and treatment if an infection is present. Question number 7. Julia is concerned about breastfeeding because she feels her milk supply is low. Which recommendations should Nurse Carla give to help increase Julia's milk supply? Letter A. Supplement with formula after each breastfeeding session. B. Breastfeed on both breasts at each feeding. C. Avoid breastfeeding overnight to allow for rest. D. Limit breastfeeding to 5 minutes per side. Correct answer. B. Breastfeed on both breasts at each feeding. Explanation. Feeding on both breasts stimulates milk production, helping increase supply by encouraging the release of prolactin. Formula supplementation can decrease breastfeeding frequency, which may reduce milk supply, especially in the early postpartum period. Question number 8. Julia asks Nurse Carla when she can start doing light household tasks. What should Nurse Carla recommend? Letter A. Start immediately to maintain muscle tone. B. Wait for 4 to 6 weeks or until cleared by her doctor. C. Resume light tasks, like washing dishes, within a week. D. Only perform exercises specifically for the abdomen. Correct answer. B. Wait for 4 to 6 weeks or until cleared by her doctor. Explanation. After a cesarean, Julia's body needs time to heal. Heavy lifting or strenuous activities can strain the incision site. Waiting 4 to 6 weeks and getting clearance from her healthcare provider ensures she does not disrupt healing or cause injury. Question number 9. Julia mentions experiencing baby blues with mood swings and tearfulness. Nurse Carla knows these symptoms usually resolve within letter A. 2 to 3 weeks, B. 6 to 8 weeks, C. 1 month, D. 2 to 3 days. Correct answer. Letter A. 2 to 3 weeks. Explanation. Baby blues generally last for a short period, around 2 to 3 weeks post-birth. If symptoms persist beyond this or worsen, it may indicate postpartum depression, which requires further evaluation and support. Question number 10. Julia is worried about her incision and asks Nurse Carla how she can care for it. Which instruction should Nurse Carla provide? Letter A. Keep the incision dry and exposed to air as much as possible. B. Apply lotion daily to the incision to prevent itching. C. Avoid lifting anything heavier than the baby. D. Perform abdominal exercises to promote healing. Correct answer. C. Avoid lifting anything heavier than the baby. Explanation. Lifting heavier objects can place strain on the healing incision and may lead to complications. Keeping the incision clean and dry, without excessive exposure to air or applying lotions, supports healing without risking infection or reopening the incision site.